COVID-19 can be concerning both for physical health and mental health. Back in April, ENN first told you that 58% of Elon students said that they are concerned about their mental health in a survey by Student Government Association. Now, one Elon student is sharing how the pandemic has affected her mental health and what she's doing to cope. As everyone's world began changing with the coronavirus pandemic, Elon senior Kelsi Stewart was dealing with a change of her own.
Because there were times where I was like, I could cry at the drop of a hat, but then there were also times where it was like, I don't feel anything at all.
Kelsi was diagnosed with situational anxiety and depression in October 2018 and began taking antidepressants just 1 week before North Carolina's stay-at-home order.
You know, when you're starting with mental health, that was really hard because you have to kind of have those moments of, okay, I need my space for a second, like to not overthink everything.
Mark Eads, a counselor at Elon, says the uncertainty around COVID-19 is naturally anxiety-inducing.
When you don't know a lot about what's going on or how the disease spreads or what's safe or what's not safe, how could you not feel tense or anxious?
Eads says it can be easy to focus on the negative things happening, but that will only make your mental health worse.
The more that you can think about, this is what I have and this is what I can act on, and to really start moving towards those ideas, putting them into practice. You'll find that a lot of times it can be very, very helpful.
For Kelsi, doing things for others helps shift her focus away from negative thoughts. She opened up about her struggles during the pandemic in a blog post, hoping to let others know they're not alone.
You can think and sit and go, man, like I have a job, I have a house, like I'm not in a position that the world would call less fortunate, but I'm still suffering through these things. And that's scary to talk about and scary to acknowledge. But if you don't, it will ruin you.
As we start to make more adjustments in our lives with the pandemic, Eads says to be patient with how it affects you mentally.
It's not all going to be, really hard one day and then all of a sudden click on the second day. So give yourself space, give yourself time, and it will get better. It just might not be as quick as you might want.
Eads says counseling services is working on ways to support students when they return to campus in the fall, like scheduling virtual appointments and having video workshops available. If stress is getting in the way of your daily activity for several days in a row, the CDC recommends contacting your healthcare provider. And if you need immediate help, text HOME to 741-741 to connect with a crisis counselor. I'm Brian Ray with Elon News Network.